Hello, very happy to have another webinar for the Good Lounge. For people who maybe are new here or that I hadn't had an opportunity to meet yet, I'm Janet Pope and I'm the president and founder of the Good Lounge, which is a nonprofit that I started to really focus on sustainable well-being. So financial, emotional, and physical well-being, because I feel like we need all of the right aspects of that in order to live our best and healthiest lives, making sure that we're providing resources and tools and talking to experts and leaders in ways that can just help us strengthen the conversation. So today we're focused on the topic, Grief Isn't Linear, Making Space for Loss, Change, and Transition. And it's part 2. And I did have a few people ask me, well, why is this part 2? Where's part 1? Thanks for that question. Part 1 has not come out yet because I felt like there's something very specific that I want to do in terms of digging into the topic related to the emotional components of handling and navigating grief. And I'm just not ready, or the Good Lounge isn't quite ready for what I would like to do with that side of the topic. But I still wanted to go ahead and have a conversation about what I consider to be the B side of grief. And this is all of the additional things that we have to make sure that we are taking care of while we're grieving. So whether that's thinking through, like, do I have the right insurance in place? What is the right support that my aging parent needs as we're working on this topic? How do I have the right paperwork as I'm having conversations with people in my family, et cetera? But really thinking through those pieces of navigating grief, because unfortunately that stuff's coming whether you're ready for it or not. And so it's just better to be ready for it, because if you're dealing with some of the stuff that we're going to talk about today while you're grieving, it's just another thing on top of everything. And it's already hard to be grieving. So whatever we can prepare for or think through before we're in that moment will just help us be better. So that's what we want to talk about today. That's what I've sort of said and framed in my head as the B side of grief. And I'm very, very excited to have my 2 panelists with me today. And I know Yvonne will be here on camera in a moment. But before we turn it over for them to introduce themselves to our wonderful audience, I want to just make sure to have our disclaimer. So the views and opinions expressed in this webinar are those of the individual speakers and do not reflect the official position of any company, organization, employer, or other agency for which they have an affiliation. The content is intended for informational and edutainment purposes only. All right. Now that we have that out of the way, I also want to just remind us that everything that we're going to talk about in this conversation today will provide real life examples, general education, and is not intended to be individualized medical or legal advice. I'm happy to be here and want to make sure people are getting guidance, reassurance, and for this to just feel like a place for how do I start as I think through some of these decisions when I'm grieving and in transition. I hope that gives us enough of a context on a wonderful beginning of the week evening where I know people are doing a lot and just trying to get through the week. Let me first turn it over for introductions. And Elaine, let's start with you.
Hello, everyone. I'm Elaine Latten from Columbia, South Carolina, and I am a senior consultant for eldercare. I wrote a book on the process of aging parents going through Alzheimer's. That was my story with my mother-in-law, and Parkinson's with my mother. So just trying to get yourself prepared for the unlikely events that come along with the decision to care for the elderly.
Thanks. Excellent. Yvonne, over to you for an introduction.
Thanks, Janet. Good evening, everyone. I am Yvonne Olusi Ogadi, also termed Attorney Yo for short. I am a registered nurse and elder law attorney, as well as a breast cancer thriver. And so I'm looking forward to our conversation tonight.
Excellent. I love that you say thriver and not survivor. I love that. And we were having a really good conversation just as we were waiting for this to start that I think sets us up good for the knowledge and the resources that we want to share with the audience. So if we start with, again, just the basics, I've talked about what I mean by this conversation. And I do want to frame it around when we say grief, what do we mean? Because for me, that includes anything it could be anything, positive or negative. So I think we tend to lean into the loss of a loved one or the loss of a job or the loss of a relationship potentially. But it could also be something that you're looking forward to, like a career pivot or moving to a new city or the mixed feelings around becoming an empty nester. So those potentially are life chapters that have joy with them. And I'm just reminding us that they also come with just a sense of loss, certainly a sense of change, and potentially grief in that transition. As we think about the things and the day-to-day decisions that can hit us in the middle of grieving, and I came to you and I said, hey, I would love to have a conversation about this topic. What's the first thing that came to mind for you as one of the most important things that you would want to talk about today? Let's start with you, Elaine.
What I would like to talk about is basically healthcare. No matter what transition you have in life or you're grieving, even if it's a career or marriage or whatever it is, healthcare is at the top of that list, and finances as one of those important tools that you have to navigate throughout your life. And for me, I think most people don't pay close attention to the healthcare coverage that they have until they need it. But when you're dealing with grief for a senior, you need to know what they have as far as healthcare coverage is concerned, if it's Medicare or Medicaid, or if it's both those healthcare coverage or a private insurer. You have to know where to start with that to know what benefits are available to your parent. And so you carry that as well, with your personal life. If you had a divorce or moved to another city and got another job, you should look at the coverage that you have. You should know the network that you are going to be affiliated with as far as that insurance company is concerned, because all doctors don't participate in the same network. So you should know things like that for starters.
Yeah, I mean, that in itself could be its very own discussion, right? In the complexity of the healthcare market and the insurance market. And so I know we'll talk a little bit more about that. I'm glad that's something that you want to make sure that we cover today. Yvonne, over to you. What's something you want to make sure we talk about in this conversation?
When it comes to grieving, specifically, one of the things I hope that we can cover is making sure that everyone understands that grieving is okay, and it is actually a natural part of the process. May it be through joy or may it be through loss, that it is okay, and that there is support out here beyond your own personal village. That there are folks out here and there are professionals out here that are here to help. And that the grieving process sometimes, like you mentioned so eloquently, is not always about loss or something negative, that it could potentially be something positive, and that is okay. And it's something that is part of our transition as we have the privilege to have another day at life. as life be life, and like some of us say, it's part of the progression of our life. As we get older, we see more transitions, and we have the privilege to see the beauty of it, as well as sometimes the painful things out of it. So that's my main thing, is just to make sure this is normal. It's part of lifing. That's what I want to make sure that we focus on as well.
Yeah, absolutely. And I think that balances the conversation that we want to have today very well, in terms of just how do we understand the everyday decisions that are showing up related to this topic. So maybe that brings me to the next question. When people are grieving or in the middle of a major life transition, what are some of the practical decisions that show up first? And maybe to your earlier point, Elaine, why are individuals and families so underprepared?
A lot of times people are just overwhelmed with the thought, and just on the part of grieving the loss of a loved one, a parent, or maybe a child that has cancer or a terminal illness. People seem to get caught up in the actual feelings of the grief, instead of sometimes preparing yourself for the later parts of that grief, and being prepared with the finances, knowing who and knowing resources that could provide substantial help for you would definitely help in that grieving process. But people seem to become overwhelmed with the thought, thinking there's no help out there, and there are lots of organizations that could help you through that grieving process and prepare financially and emotionally, just like Yvonne said.
Yvonne, any other bills on that?
Yeah, I think also your question was specifically about everyday decisions, and so Elaine has spoken about like taking care of our elders, maybe your parents or auntie or a friend who is a senior, and having to navigate the healthcare system and making everyday decisions of, okay, what are we having for dinner tonight? And who's going to cook it when they're unable to do it for themselves? So things like, even in my own situation, as I said before, I'm a breast cancer thriver. I was diagnosed in June of 2024. And everyday decisions like, after chemo, what am I going to eat? I couldn't even think about it. And everyone else was just like, I'm just happy that we made it through the chemo. I couldn't even think about just the basics. And the folks, my family and village that were surrounding me and helping me, it can be very overwhelming when you're in that position, and as a caregiver or supporter of what does that person need, or and what decisions have to be made. Everything from, I'm a mom as well, who's going to pick up the kids, who's going to plan this, who's going to attend this. All those things become overwhelming, and sometimes you forget things. And so it can be from the most seemingly minute detail of life that now begins to become this gigantic boulder of decisions that can then overwhelm you. So it can be the most simplest thing to the most complex of who and what are we going to do if mom does not wake up, for instance, in a case where someone may be in some type of comatose state, to something as simple as, what are we having for dinner? And that could be a huge decision because you're
And
overwhelmed with so many other things.
to add to that, legal aspects, being that you're a lawyer, POA and healthcare power of attorneys are things
Exactly.
that are necessary, especially when you have someone that's incapacitated. And when you don't list someone in your family to be your caregiver, to be responsible for you when you can't make decisions for yourself, is crucial, because we all need someone to speak up for us and to be our advocate. And a lot of times their services, if you don't have someone with hospitals, they have a medical social worker at all hospitals that are able to provide support for you. to lead you if you don't have the right insurance or you don't have the finances to have independent insurance coverage. They can get you signed on to Medicaid and help you that way. But you need someone to be an advocate for you, and you need to, we impress that upon our parents, to make sure you had a power of attorney and name the child or the person that you want that is responsible enough to take care of you medically and financially. You need someone to speak up for you.
Yeah, absolutely.
Absolutely. Absolutely. I don't know. Absolutely. Again, I'm in the elder law space and estate planning and probate. So I see all
Mm-hmm.
parts of this. And that is
Mm-hmm.
critical because we talk about day to day living and questions and answers of the most simplest things. But then it comes down
Mm-hmm.
to who's going to make that medical decision for mom or dad or auntie or the
Mm-hmm.
loved one or a partner. And if there's no legal documentation in most states, I practice in Texas, in most
Mm-hmm.
states, it will be the next of kin if that individual's life is in danger or
Mm-hmm.
um, a critical decision has to be made. It will be made, but after that point in time, we still need a legal documentation that states who will be that lead decision maker for that individual, both medical and financial. So those
Yeah.
are critical.
This is great. And I think you're getting to the point where you can transition to the camera now. So I want to shift this next question. And I know why a lot of people have joined today to Elaine to just talk specifically about Medicare because we're confused. I mean, I'll speak for me. Let me back up. I'm confused. Can we just start with the difference between Medicare and Medicaid as just let's start there?
Okay. Medicare is an entitlement program. Everyone doesn't qualify for Medicare initially, but as a senior, you qualify for Medicare at age 65 because if you worked in the job sector and you paid in to Social Security, of course, you're 40 quarters, 10 years consistently, you qualify for Social Security, which is a different thing. But you also pay into Medicare every time you get paid. So look at your pay stub. You will see Medicare, not Medicaid, Medicare, Social Security. Those things you will be entitled to. Those are called entitlement programs. So as you turn, right before you turn 65, uh, CMS, Medicare will, Social Security will send you notification that you have a birthday coming up, and you have a total of 7 months to apply for Medicare coverage. That's 3 months before your birthday month, and then 3 months afterwards. You have to call Medicare or go online, medicare.gov, and you have to sign up for that program. And I'm telling you, you have to sign up for that program because one, you're entitled to it, you paid for it. Medicare Part A is the free part of Medicare that you don't have to pay a premium at all. And that covers hospitals, nursing homes, and uh, skilled nursing facilities. But if you want Part B and you're not working, you have to pay a premium for Part B. If you don't select that premium for Part B and you don't let them know that you don't want Part B, then you'll have to pay a penalty after that year. And the penalty is increased every year that you do not accept Medicare Part B.
And
That's your
what
doctor's
is Part B, just so everybody's
part.
clear?
Medicare Part B is your doctor's visits, your specialty, like if a doctor refers you to a cardiologist, then all specialty services. It's durable medical equipment, wheelchairs, walkers, crutches, those kinds of things. That's Medicare Part B. It's a lot more things that goes into Medicare Part B. You can also get, if you had some type of surgery, occupational, skilled therapy, and speech therapy is covered. And you'll see those items billed when someone's had a stroke. It's covered under Part B if you're getting it at home. It's covered under Part A if you're still in the hospital and receiving those skilled services. Medicaid, on the other hand, is income based. And it's income based on, and the calculator and the income information is on cms.gov. And based on your state, and it's a little political now, based on your state, every state has a Medicaid contract. And Medicaid is covered if you're below a certain income, you have to apply for it online or with the state that you're with. And that's how you get Medicaid. The difference between Medicaid and Medicare is an entitlement program that you pay into. Medicaid is income based.
Very clear. Very clear. So what's a Medicare decision that you wish families understood before a health crisis?
The number one thing is to not miss that open enrollment date. Because it's important. If you
I second that.
If you qualify for it, then you have that 7-month window. 3 months before your birthday month and 3 months afterwards. That's seven months.
And this is your 65th birthday.
65th birthday. So you can enroll 3 months prior and 3 months after. If you don't make, and you don't have to select Part B. However, if you're working and you don't need Part B and you don't need that additional insurance, don't get it. But when it's time for you to enroll in Medicare Part B, you have to show that you were actively employed. And that's why you did not select that coverage.
I see.
And that's where most people misunderstand it, because the premium goes up every year and they do not give you a break.
So you want to either enroll in Part B as soon as you're 65.
Enroll in Part A.
Okay.
Part A is the free insurance. I mean, It's not free. You've already paid for it. But that's the part you don't have to pay a premium for. And with most people, if they accepted Social Security at 62 or 65, it will come straight out of your Social Security check, the premium for Part B.
Okay, got it. Okay. So, but they need to tell the government something if they're not going to use Part B.
You have to enroll in the program. Yes.
Every time. Yeah.
Mm-hmm. Enroll no matter what.
The other thing I would add is that you can also be penalized. I've had clients that have been penalized for not.
Yeah, that's the penalty every year. And they add on to that penalty. Every year you don't select the coverage of Part B or an Advantage plan, then you have to pay more in a premium.
Mm-hmm.
So you have to sign in at 65.
That's clear to me.
Mm-hmm. And why wouldn't you? I mean, if you have a job and you have healthcare coverage on your secular job, you just have multiple coverage.
Yeah. Okay. All right. What about bereavement coverage, hospice coverage?
A lot of people don't know about Medicare and bereavement. When you are on hospice, they give you a packet. And the packet goes through the assessment of the registered nurses coming in, the aides that may be coming in to provide services. And within that package, they are required to give you the bereavement information. You have counseling services for 13 months during that hospice period, and it could overlap after that person passes away. Mm-hmm. So you have that opportunity. If you have Medicare and Medicaid, which some people do, because they qualify for it, they worked, and they have their income is at a lower range, so they qualify for dual coverage, and that's called Medi-Medi, and all states offer it. You can also, get bereavement through Medicare and through hospice. You have to be on hospice.
So one of the things about the hospice, that's a really good question, because I'm going to tell you, it's very underutilized, especially in the community. because a lot of times
in the Black community, you're saying?
Yes.
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 Okay.
Yes.
Yeah. In the community, it's Black and brown. Most wherever you are from the diaspora, because people believe as soon as you say hospice, they're gonna pass away tomorrow. Or as a background, I'm a registered nurse, as I mentioned. Many times I would see that we knew that someone was on their way. They were already showing all the signs. We've already exhausted all the treatment regimens, etc. But it's, in order to qualify, a doctor has to write that the individual has 6 months or less to live.
Yes.
And a lot of times we would see individuals with 24 hours to 3 days to live. And the hospice benefit is one of the most underutilized benefits in our community, because what it does is it provides, we had hospice for my grandmother, and I'm a nurse. And so I knew about the care in the program. One of
You're breaking up for us. I think you were just about to get to the good part too, unfortunately.
Well, I'll go on until she gets back on.
Yeah, we'll let her come back in here. But yeah, did you have anything else to say on that? We'll circle back to Yvonne.
Well, yeah, that's the thing. Hospice care and palliative care is what a nurse or your doctor may tell you your loved one needs. And it's one and the same as far as Medicare is concerned. And like she said, it has to be a physician has to recommend hospice care, and the certification period is for 6 months. And within that, oh, you're back? Oh.
You're muted.
I apologize. I've been moving around and moved around, and then it started sticking when I was talking about hospice. And I was like, okay, I'm just going to have to stand in the place and hold one arm up.
It's okay. It's okay. So do you want to finish that thought before we move on?
Yes. What I was going to say is that hospice is a beautiful, it's a beautiful benefit that we've earned. And a lot of times our families, we don't see them until they're less than a week from passing away, when the family, as I was saying, my grandmother, she had hospice care, and it's 6 months or less. And the thing is this, it doesn't mean they're passing away tomorrow, but the level of support, the nurses come to the house. There's doctors that come to the house. They give you all the equipment, beds, we call them Hoya lifts to help lift them up and to make them comfortable. They pay for all of that, their diapers, all the things to keep this individual comfortable as they transition to the next side of things, you know? And so one of the things, go ahead.
Why do you think it is the Black community does not leverage that benefit if, you know, it's our benefit?
Denial.
Number one.
Denial.
Nobody wants to talk about it.
No.
Nobody wants to talk about it. It's already one thing that, you know, I'm in the business of estate planning. It's difficult to get some of our folks to get your will together, get your trust if you want to trust, get your ladybird deed or your transfer on death deed so that the property can be transferred properly to your family and not locked up in a court or
probate
taken because taxes weren't paid. It's the elephant in the room, and no one wants to talk about it. And the person that needs to talk about it is the individual. One thing for families, right? But it's another, like things like advanced directives. What do you want at the end of life? Because if you leave it to your children, they may not all agree.
True. Yeah.
And if you have that one child, that's a heavy load. We talk about grieving. I watched my mom, as we were talking about this, my grandmother had Alzheimer's, dementia, and she had breast cancer, but it wasn't the breast cancer that took her life. It was the dementia. She finally stopped eating. She didn't remember how to eat and chew. And her request, she did us a favor. She put everything down in writing 15 years ago. Yeah. And she said, I don't want 2 feeds. I don't want these things. And we honored that. And I praise God because I have 8 tias and uncles and aunts. So yeah, I praise God for that. But I think part of it is education and not wanting to talk about it, because if you say they're going to die tomorrow or today. And that's not it.
No, that's a really good point, right? Because I mean, what you're talking us through and, you know, starting to even give us things to be thinking about is how do we make sure that we're having the right conversation, even before anybody's sick? Like, hey, this is what I want. This is my living will. This is how I want you to follow these things, and not being afraid of that conversation, right?
Well,
Yeah.
and the one thing that I tell friends and former coworkers and people that ask, have that conversation over Easter when you gather. Have that conversation at Thanksgiving when you gather with family. And sometimes parents can be intimidating. And so you have to plan it out and let someone be the spokesperson if you have multiple children, siblings. And so Christmas time, whenever you know most of the siblings are going to be home, get together, practice it, because they're going to come after you with everything, all the resistance in the world. We have time for this. And sometimes you don't have time.
Or you
And
don't
when your
know how
parent,
much time. Yeah.
you don't know how
None of
much
us
time.
know.
And
Unless
so
there's writings on the wall.
that's a good way to approach it. And another thing I wanted to add to what Yvonne was saying was people don't recognize what their VA benefits are as well. I didn't know until probably 2008 or 2009, when my husband's mother-in-law was really sick, and his father died when he was 25 years old. And she never really ventured into VA benefits or anything. She just did a lot of things on her own. And a friend of mine told me about what happened to his father and the aid and attendance that the VA offers to spouses and veterans. And every time I told somebody about the aid and assistance, they did not know. And I knew their parent had served in the military. And it's just, you could go on va.gov and find out about it. But if you don't know, you think you can afford a nursing home or an assisted living facility at this place, and you can get an upgrade, and you could search around and find one that the VA will pay for. They have a list. And, you don't have to, try to save money and do all the stuff, because it's expensive. Nursing homes are like $6,000 or $7,000 a month.
Oh,
And
on
when,
average, they're about
yeah,
7,500, and that's for the baseline basic. You
yes.
probably don't want to be there. The ones you want to be in are the ones that are $13,000. I don't know who has extra $13,000 minimum a month for the.
And it varies.
It varies,
It
but
varies from one state to the
a,
next. Yeah.
yeah, and
Another
it
states are
varies
like
from one state to the next
$20,000.
Yeah.
per
It
month.
was the look to the left, to the right for me, because we don't have the money. Absolutely.
Yeah. And so you have to know what your resources are. And
Elaine, that's a good point with the VA, because that is another underutilized, because sometimes unfortunately the experiences that our veterans have just in the VA system itself on the healthcare side is not always the most positive experience until they finally get to the end of the line. There are attorneys, there are professionals who are certified through the VA, who must be certified through the VA, that can assist veterans and their families with obtaining benefits. And doing that application process, because it can be tedious. Anyone can DIY a lot, but you slow yourself down sometimes, and especially if time is of the essence, and mom or sister or auntie or whoever, uncle, needs those particular services ASAP. I encourage everyone to enlist a professional who knows how to do this and can cut the timeline in half. Because the truth is, my mom is part of the sandwich generation that I'm now transitioning to. My grandmother passed away. We kept her home for as long as we could, for several years, for 5, 6, 7 years now. We kept her home before she passed, and that was her one request, and we were able to do that. And so one of the things that I would appeal to everyone is, as you're talking to your elders and having these critical conversations, it has to be had, because at the end of the day, I will be the one, or you will be the one, trying to figure this out on your own. It can become overwhelming. It is overwhelming. Even for me, who does this as a nurse, who's also an attorney, because the truth is, this is mom, or this is dad, or this is uncle, or this is grandmother. And the emotional impact of grieving in place as you're watching your parents age, or your loved one age, or deal with disabilities. Sometimes it's not even just aging, it's disabilities. Even as myself, as a breast cancer thriver, I'm still not working full time. I am still dealing with pain, having to go to occupational therapy, having to do all those things, and still trying to figure out, how do I make sure my dad is okay, who just broke his hip? How am I going to be there in place for them, as well as be in place for myself? And making sure you have the documentation and leveraging your resources is critical. You don't have to do it alone.
Yeah, you're starting to talk about the impact of all of this on caregivers, which I want to dig into a little bit more. So let's do that, and then we'll come back to some more of the tips that we want to make sure people have as they navigate healthcare and our crazy system. When you think about, and you talked about it a little bit, like how family dynamics can show up in the preparation decisions, I think about, like, I wish I had this conversation in my 20s, because I literally remember my grandmother, and in some cases my mother and my father, me being younger, maybe early 30s, just wanting to like have the conversation, and I'd be like, man, like, like, why we want to talk about that? But really, we should be talking about that. Like, don't wait until somebody's sick before you're having the conversation. But there definitely was this like, you bringing the vibe down, or like we're having a good time over Thanksgiving. Why do we want to talk about that thing? And so, to your point, helping to make people feel like it's not an awkward conversation, or it doesn't mean like I'm planning your demise because we're talking about this. Like, it literally is just us making sure that we're prepared so that we don't have to worry about it in the future. And again, just going back to the family dynamics of this, what are additional things we should just be paying attention to because of the impact of this on caregivers, and the fact that caregivers are usually like oldest daughters, women? It's falling a lot on the same people that a lot of the things fall on. So I just wanted anything that you had to better support people on that.
I would just straight from now, my attorney hat is on now again. Yeah. One of the main things that I'm going to tell you, and nurse hat and attorney hat, listen, dementia is a real thing. Alzheimer's is a real thing. We can all be in denial, but legally there comes a point where I can't help you because your loved one, they can't legally sign these documents that you so critically need. And so if you begin to see changes, significant changes, don't just say, oh, it'll just get better, or I'll deal with it later. Help your loved one.
They're just forgetful. They're just forgetful. No.
Yes, there's a level of forgetfulness, but it's another thing. I'll give you an example. Oh, yeah. I knew my grandmother was already having signs and symptoms of dementia. My uncles and my aunts, they just thought it was part of aging. Until she lived in San Antonio, until she was wandering around Walmart parking lot in the summer heat of San Antonio, Texas, with sunburn. And the security officer called my aunt and told her, your mom lost her car. She could not remember where her vehicle was. My grandmother couldn't remember. And then the light bulb clicked.
Yeah. Well, my husband was the same way. He was basically the only son that was in South Carolina. His mom was in Charleston. And every time I saw her, I knew, because I'm a woman, you just notice different things as a female, as opposed to what a man noticed. And she told the exact same story, the exact same way, every single time. She taught school for 42, almost 43 years. She was a very intelligent woman, and she loved to dress. I mean, hat, shoes, everything matched. When she was not coordinated, and she repeated the same sentence or the same statement over, that was a red flag for me. My aunt had it years ago, like in the 90s, early 90s, and I recognized it with her. And she didn't have children, but my mother-in-law it was just evident to me. And when we took her, she didn't want her son to take her to the doctor. She didn't want him to go with her. And I said, well, we'll both go. And we went. And she was so upset because the doctor gave her a test that they give for dementia and Alzheimer's patients. and she did not pass it. And she was upset because she didn't pass the test. Not that she knew exactly what was going on.
Yep.
She just thought we were infringing upon her independence.
Sure.
Correct. And that's the way it comes.
Yeah. And so and that's what dementia and Alzheimer's does. Most people in your family will always deny that they have it. But when you recognize it and you see it, you need to get that help.
Get the help as soon as possible, especially because there's so many new medications that are coming out, but also because we want them to be safe. We shared stories there's stories on the news. Here in Texas, we have a silver alert. That's how you know a senior is missing here in Texas. And so what you don't want to do is for them to end up wandering out or being alone.
Exactly.
Or just
that's what they do.
Wandering out, being alone, leaving the gas on in the winter for some of those cold states and not waking up.
Right.
Safety first.
A victim.
So for caregivers, any tip for the caregiver before we move back to healthcare specifically?
I think caregivers need to seek help and a support system. And each state has a Department on Aging, and that is a great resource to get help, talk to people, get on the phone. If you can't leave your loved ones, at least talk to someone on the phone. And I think here the United Way has a 211 number that you can call. And I think it's across the United States, but I know it's in South Carolina. And if you need help, if you need support, they will provide that for you, as well as something called respite. And the Department on Aging gets a grant from the federal government every year. And sometimes the money runs out faster. But I noticed that a lot of home health agencies and hospice agencies will offer some type of respite care for a caregiver. And people just don't know that it's available. Sometimes it's 3 days, sometimes it's 24 hours. But it's there, across the United States for people to use if they need it. And you need a break as a caregiver. You just do.
You must have a break. I echo what Elaine said. One of the things I'll tell you is I watched my mom care for my grandmother is you must take care of yourself. You got to take a break, because at the end of the day, I know you want to be there. You may be the only one amongst 10 siblings, but you must take care of yourself, because statistics show and prove, the data has not lied. Typically, it's caregivers that pass away before the person that they are taking care of.
Wow. What's the number on that?
I forgot to pull the data, y'all. I'm sorry, but look it up. It's there. Caregivers, health, the level of stress, the level of sleepless nights, depending on who you're dealing with. You never really get to sleep. I witnessed this with my own mom. Thank God she's still here. But you must take care of yourself, even if that's for 2 hours out of the day. And people will tell you, I don't have anyone. You have to find some other people that you trust that can be there for that individual, so you have the respite that you need in order to continue to doing a great job of being that individual, your loved one's caregiver.
So I looked it up earlier, and it said the mortality rate for caregivers that have the highest risk is about 63%.
Wow.
Of caregivers will leave here. And the
prior
mental
to the person
anguish,
they're taking care of.
Because the mental health declines. They have chronic conditions that they generally don't seek help for. And the number one, two things: heart attacks or strokes, where if they don't die from that stroke, they're incapacitated. And they need someone to take care of them at that time.
Caregivers have to take care of ourselves.
They have to take care
And
of
like
themselves.
you mentioned also too, Janet, was that typically it's females that are taking care, that are the primary caregivers, but they're not caregiving just for their loved one. They're elder. They're taking care of the family. They're taking care of extended family, work, and everything else.
Yeah, women have a lot of roles. Absolutely. Yeah. Okay, so just circling back to healthcare, because we could talk for 2 hours on this topic. And I mean, we all recognize and understand how interconnected insurance is with employment in the U.S. specifically. And, just outside of employer healthcare benefits, which I mean, even sometimes can be a little bit confusing and overwhelming. But putting that aside, what is something that we should be thinking about in a job transition, or when we're becoming a new parent, or when we're supporting an aging parent, in terms of just like tips that people should to think through so that they avoid costly and stressful healthcare missteps?
Something I recently experienced was Cobra. You know, I'm still out of work. Cobra, you can leverage your health insurance through your employer if you are separated for them for health reasons or separated in between jobs. They still have a requirement to cover you through Cobra, and Cobra can last up to a year and be extended for 6 months. And so what that means is they're not going to pay their portion if they were paying half or all, if you were so lucky. Literally, you will have to pay whatever that premium is monthly. And so you can still have insurance, because a lot of times that's a concern for individuals that may have chronic diseases, or if they have children also, or children or loved ones that are on their plan that also need to continue with the health insurance. That can still be done through Cobra, and you go through your employer for that. The second thing is the marketplace. A lot of times people talk about, oh, well, the marketplace is closed, I can't get any health insurance. Maybe something happened, some event happened. Yes, you can still get on the marketplace. There's limited plans depending on your state, but you can still get a plan, a healthcare plan, through the marketplace. There are specific events in which they will allow you to sign up. So don't think that it's all, closed off until enrollment again, and until January 1 of the following year. Those are the two things that I would suggest.
And I would say EPA, the Employee Assistance Program, they're required to have one. They offer services from psychologists care. They have referrals for nursing homes. They have referrals for a lot of different things. And then FMLA, that's also offered to, if you have a job, and if you have PTO, if you ran out of time, once you apply for it, and there's a form that you have, there's several forms that you have to submit in order to get that. But if it comes down to, if your child is sick, if your spouse is sick or had surgery or an accident, if you're taking care of parents, that could be covered under FMLA. So that's a really good, especially when you're working and you have younger children and you have aging parents. That's a really good resource to use. And protects benefits. Your employment as well.
Absolutely.
One last thing is that here locally, there are several independent healthcare systems and providers that have their own insurance. That it's not part of the marketplace, it's not part of an employer, but you sign up to be with that particular. And some of these organizations sometimes are run by the county or the city or the state, but there are healthcare facilities that will still allow you to pay a certain premium per month to have access to their doctors and facilities. So look into that as well. And it's specific to wherever city, town that you reside in. So
that's good to know, because that sounds like that would be useful if somebody's in between jobs for an extended amount of time, and maybe Cobra's run out and they need another option. So thanks for that.
And I know there are a bunch of healthcare providers here and healthcare workers here that have insurance through a co-op, and they all pitch in money for every month, just like they're paying a premium. And so when their child has to go to a well check or a doctor's visit, that co-op pays a copay for them. And I don't know how it works altogether, but the girl that I spoke to, she said they love it, because when you have young kids, unless they have something catastrophic that happens to them, your insurance net is really low. And that's why you don't have to pay that much for your children coverage as opposed to your coverage. But like Yvonne said, look into all your different avenues for insurance coverage. And remember that, Medicaid's available in every state. Some states have more Medicaid benefits than others. If your state did not accept Medicare benefits, but you have to go under SHIP and apply and let them turn you down. if you can't afford to get, health care.
Yeah. No, this is all really, really useful information. And I mean, we happen to be in a moment where I've seen some large corporate employers backing down on benefits that they're offering.
Mm-hmm.
And so I think everybody's just going to need to become more well versed in their understanding of the marketplace and just their options.
Mm-hmm.
Any other practical resources that you want to recommend to our listeners to be better prepared?
I think and this is, again, is for seniors, A Place for Mom is an invaluable tool. They do the legwork for you. And I would suggest that if you use a referral service to find a skilled facility or a nursing home or whatever your parent may need, go and visit that facility.
Absolutely.
Don't just take someone's word for it. That's what I did with Medicare for 29 years. I inspected facilities and provider businesses. But when you go into a nursing home, every state is required to have inspection documentation available. So if you're asked to look for it, they should provide it to you. And if they cannot, walk out the door, because they're all graded on a system. And so sometimes the fancier nursing home, you may think because it costs more money, is the best one, and that's not always the case. Always search and look up their information online. And every state has a Department of Health and Education Services. So, for the state of Texas, they have a DHEC as well. Look them up and get the information online, and then go and visit before you put your parent
Pop up. Just pop up. Just walk in.
Oh yeah, just
unannounced
for sure.
Walk in at night.
Walk in at night.
Yes, absolutely. You'll see the
In the
staff and
evening.
see who's not there. Yeah.
Mm-hmm.
Because
Okay.
if they're selling you a certain percentage of staff to that, the ratio of staff to patient,
Right.
all on it. Yeah, show up.
Absolutely. That's
Absolutely.
good. Yvonne, any resources or tips?
As it pertains to this, the one resource is Medicare.gov always. They have something, Medicare.gov. They have home health compare. If you're dealing with home health or hospice, they have comparisons. And just echoing what Elaine said, I was going to say that just as well. The surveys, so the surveys that the state goes in, the inspectors will go in. They do it every 2 years, every 3 years, depending on their credentialing. But that report is also online. So you can see where their deficiencies were, right? And and it goes back. Take a look. You have to do the research. We Google everything for everything else. We read all the reviews to go rate a restaurant. You may not always find, a 5-star skilled nursing facility or long-term care facility, but a 3.5 is better than a 2.0 that walking in that there was already problems that haven't been resolved over time. Nowhere is perfect.
Absolutely.
But at least you have the data to go with, and not just random Google reviews, because typically when people review, they usually review if it's really a great thing, or it's not, or it's not consistently. And so all that matters. And it's hard. These are not easy decisions and easy conversations to have with loved ones, right? As we talked about grief, you have to always remember the individual that's sitting across from you, that person that you love, may be whomever, your partner, your loved one, your dad, your mom, your uncle, your aunt, they're grieving too. And so the resistance, sometimes we have to give them grace, because the resistance sometimes isn't just to you. It's because they too are transitioning and they know it. And now they're dependent. My superhero, right?
Yeah.
So give them grace.
Anything else you want to share for how people can find you and leverage your services, Yvonne? I know it's specific.
Oh, yeah. I'm specific to Texas, but I don't mind speaking. attorneyo.com. Also, you can give me a call. I'm sure my information will be at the bottom. I'm more than happy to speak with you. I can't speak to all the other states, but I can definitely speak to Texas. And I have colleagues that work in other states that I can refer you to if you need help with an elder law attorney. Elder law attorneys specialize specifically in dealing with individuals that are elderly as well as disability planning. I will tell you that the last tip is planning is key. We got to be more proactive in order to preserve generational wealth. The whole purpose and why I even went back to school to become from a nurse to an attorney is that I seen so much of our community, Black and brown community across the country and here locally where I live in Houston, losing so much generational wealth because of lack of knowledge and understanding and lack of planning, estate planning. We're having gentrification going left and right. You just sold grandma's house because there was $3,000 worth of unpaid taxes. You let the developer buy it for 30, 40, 50,000. They just put a 1.2 million compound there.
Right.
No. We gotta understand and know.
And to that, with property, if you are enrolled in Medicaid, there's a 2 to 5 year window that if you have property and you are using Medicaid, your property is going to be held by that state.
And
Until
you have tools. This is where
and
the
you
the
have
attorney
tools.
comes in.
Absolutely,
You have
absolutely.
tools.
That's why because you're that attorney, and because Medicare doesn't count, but Medicaid does, and that state will want their money back. And if you have property, and if you hadn't put that property in a trust or something to protect your legacy or the legacy for your children, then the state will stake claim to your home.
They do come back and they do send. It's called MERP, Medicaid Estate Recovery Program. It's across the United States. And what happens is just on the, I'm going to do this quick snippet. I know we're almost closing out here, but just nugget for everyone, no matter what state you're in. Some states have more tools than other. In Texas, we have ladybird deeds and transfer on death deeds. In other states, they're called other things. But what it does is a specific type of deed that will transfer the property to the beneficiaries, whoever is listed on that deed, once the individual passes away. And so the owner, the elder or the whomever will maintain ownership of that property until they pass away, at which point it will transfer to that individual. So there's no probate court. There's none of those things.
Listen, you've said a lot, and the best thing that probably ever happened is a nurse going from being a nurse to becoming an attorney on this topic. Like, it's just right in your pocket. So I know you shared your contact card with me. I made your contact card available at thegoodlounge.org/Yvonne. Just if people want more information and want to find you directly and have a deeper conversation with you on this topic because you are so knowledgeable on it, that is available. It won't be available forever, but it'll be available at least for the next 30 days if people find this webinar later and want to reach out to you directly. And then, Elaine, you wrote a book on elder care. Can you just talk a little bit more about that?
Well, the book was in reference, it's called Marguerite's Story, and it was in reference to my mother-in-law having Alzheimer's. And we didn't touch on the fraud and abuse and elder abuse a lot, but she was a victim. And we knew that she was a victim, but we just didn't know who it was. And so I documented so much of it, working in the fraud department. I was just used to, when things didn't seem right, I wrote it down. And she was a victim until we had to go to court and become her guardian and her conservator. At first, they listed a court-appointed guardian. Because the people that were taking advantage of her were hiding behind the scenes. And so when we found out literally after she died who it was, but and that was God's grace for us to not know who it was prior to that. But that's what the book is all about, the journey that we traveled, taking care of her and, of course, my mother while she was dealing with Parkinson's. And just putting some resources in that book, and like Yvonne said, letting people set up trust and knowing how to create a will and taking care of the business at hand before it gets cloudy and you can't do anything without, getting the courts involved. But in our case, it protected her and it saved her life. The quality of her life was a lot better once we got her up here in Columbia.
Okay. Well, thank you so much for writing that book. If If anyone is interested in, there's a whole list of resources that Elaine shared with me that I can't, there's no way to share them in the chat. If you want that document, email me at goodloungeorg@gmail.com, and you can literally just say grief document. Like, don't feel like you have to say hi and all this thing. Just say grief document, and I will send you that document just as Elaine shared it with me. And then part 1 of this series, as I mentioned before, will further explore the mental health lens of this topic and how we navigate grieving from a mental health perspective. If you have enjoyed this topic, I would just like to remind you that the Good Lounge exists, and we're a nonprofit. We're able to provide support through resources and really more towards the in-person things based on your donation. So $5, $2, $10, we thank you in advance. You can go to thegoodlounge.org/donate if you so care to further support us. With that, I'd like to say thank you to both my incredible panelists in their deep expertise on this particular topic. I know people will be reaching out because of just everything you understand on this topic that we barely scratched the surface of. But hopefully it gave people enough to understand that maybe they have more questions that need answers, and they can start to do more research to understand what else they need to do to be better prepared. So I thank you for your time. I deeply value your expertise, and I hope you have a great rest of your week ahead.
Thank you.
Thank you for having us.